Hello and welcome to the Well Women podcast. As always, I'm Dr. Laura Pfeiffer, naturopathic doctor and creator of the Period Passport online program and Her Time of the Month membership. Today, I have a special guest with me. This is Jenna Longoria, the period guru, and actually a little bit fangirling over here because I have followed you on Instagram for a while. And I love your content and I love everything you post. So I'm super excited to have you here. Thank you for joining me.
Thank you for joining me, Laura. It's so great to be connected because I know that we've been, following each other's work on social media for a while. So it's nice to chat.
Yeah, absolutely. I'm just going to give you an introduction. So I mentioned Jenna Longoria is also the period guru, board certified functional nutrition practitioner specializing in women's hormones. She was listed by the Huffington Post as one of the top 20 new health writers to follow in 2017. Her work has been featured in Mind Body Green, NBC, The Elephant Journal, SXSW, and she is the author of the Period Solution 28-Day Hormone Balancing Guide. Through her virtual private practice, Jenna helps women reclaim their hormones and digestive health with a multidisciplinary approach, combining functional medicine, nutrition, and diagnostic lab testing in her results-driven root cause program. Jenna is a firm believer that the right diet and lifestyle can put any hormonal condition into remission. I'm super excited to chat today. Specifically, hormones can take us a variety of paths, but today we are talking specifically about PCOS. So I want to start by talking to you about your journey with PCOS. So tell our listeners a little bit about that.
Yeah, I'd love to. So when I was a teenager, I was having a lot of digestive issues, and I was having a lot of abdominal pain upon menstruation. And it turns out I was having these large ovarian cysts. And I kept on going back to the doctor. And, I also was having irregular menstruation. And they were like, well, let's just put you on the birth control pill. Yeah. And, that was at 14, which is excellent advice, right? As we know, not really. Yeah. So at the age of 14, I went on the birth control pill, and what I thought was that it fixed the problem because, hey, all of a sudden I'm having a withdrawal bleed every 28 days and the ovarian cyst went away. So great, right? But then also what happened is I gained about 15 pounds within 6 months. I started becoming depressed, and I was not a depressed teenager. I was a very athletic, and I was into theater. I was very outgoing. And I turned into this person with a lot of anxiety and depression. I couldn't get on stage anymore. I didn't want to do sports. I became, just really introverted and depressed, and had to get on Prozac eventually because of the depression at the age of 15, which made me gain even more weight, which, I'd already gained weight from the birth control pill. Here I gained weight from Prozac. And it just was nuts. So when I was let's fast forward almost a decade later, I'm in the middle of university, and I decided, you know what? I don't know where this red light came from, but I just had this this light bulb. I was like, maybe the birth control pill isn't good for me. And I had no research to back this up. I was studying communications. Yeah. It was just an idea I had. So I got off the birth control pill, and, I didn't have a period for 6 months. I had horrible symptoms. I had acne, mood swings. It was nuts. And so I don't know what happened, but, someone in my realm was like, hey, there's this herb bar down the corner. I was going to university in Austin, Texas, which is kind of like a hippie city. Yeah. And so I went and got these herbs that included Vitex and things like
herb bar.
Yeah, it's an herb bar, but not oh, sorry, that's my light. Not and so, but so really, it was so funny. And they put me on a mixture of this herb tea, and my period started to regulate. But I guess I should preface it before I did that route. I went back to my doctor 6 months later after quitting the birth control pill and not having a period and having all these horrible symptoms. And the doctor said, oh, I can help you. And I was so excited. I was like, yes, you can help me. Okay. And he wrote me a prescription for the birth control pill. And I was like, wait, that's not what I wanted. And I was like, oh no, what is this? He's like, well, this will give you a period again. And I looked at him and I was like, I want my body to be able to have its own period. And I'll never forget this because he looked at me like I was a crazy lady and gave me this patronizing, why? This look, and said, why? And I didn't have the answers because at that point, like I said, I hadn't gone back to school. I hadn't rerouted my focus to nutrition and women's health. And so I just said, well, So I felt really invalidated, and I felt like I was crazy for wanting my body to do this biological function that we're designed to do. That's a sign of health. So I took the prescription. I never cashed it in. I ended up going to this herb bar, but when the tea actually helped, I was like, wow, there is something to this, and I need to study this, and I need to find out how we can support our bodies naturally and bring them into balance. And, it was later that I found out I had PCOS, which was never diagnosed because of the birth control pill use for so many years. And, that was a journey in itself once I got the diagnosis to work with my body, work with my genetics so I could thrive and put my symptoms into remission, so that when I do decide to have children one day, I can, and I can live and be a PCOS thriver versus a victim with PCOS.
Yeah. And I think that your story is all too common. Either my patients are in the same boat as you and never really received a diagnosis as a young teen because they were just thrown on the pill, or they were given the pill and a diagnosis and they were told that it didn't matter until they wanted to have kids.
Exactly. That's my favorite, right? Yeah. Come back when you're ready to have children. Like, our only function as women is to give birth. Like,
Yeah, and the only reason we need hormones or a period is to give birth, is to conceive and give birth. And so that is just a wild, wild misconception that we really need to squash. And I love that you also mentioned I had a withdrawal bleed every month, because a lot of women think that they're being put on the pill and it regulates their period. And they don't realize it's not a real period. It is just a pill bleed or a withdrawal bleed. And so
exactly. I love that, like, empowering. I used to think, oh, that's so pedantic, when people have different names for things. And then when it was like for period, withdrawal bleed, distinguishing between that. And Dr. Laura Brydon is very big on that. And that's really, her book introduced that concept to me. It's like, yeah, it is very important. Just like knowing the difference between labia, vagina, clitoris, knowing our anatomy so we can be more empowered. Like, it's the same thing with the bodily functions. Period and withdrawal bleed are completely different things. And, so it's important to distinguish them.
yeah, and I actually was speaking on a podcast a couple weeks ago, and we were talking about how, like you were just saying, 50% of women in one study did not know their anatomy. They did not know
Yeah.
the difference between the vagina and the labia and the clitoris. And it's very interesting because when we're talking about it, we just say vagina, like it's the whole
Yeah,
thing.
that's all. It's all the vagina. That's like all we're taught. That's all that matters.
Vagina, and then shh, that's
Yep.
it.
And then, yeah, exactly.
And then never talk about it again.
Mhm.
So I think it is really important that we normalize that and make it feel comfortable to speak about, because this is our normal bodily function. And so let's talk a little bit about, tell us about what is PCOS and the different types of PCOS and the different root causes that we can anticipate to investigate.
Yeah, absolutely. PCOS, polycystic ovarian syndrome, is a syndrome, which means there's an umbrella of symptoms, and that's why it's a syndrome. And that's one reason it can be very difficult to diagnose, because how PCOS looks on one person is going to be completely different on how it looks on another person. Because, there are all these different symptoms like anxiety, hair loss, weight gain, insulin resistance, and ovulation. These are all, hair growth where you don't want it, male pattern baldness. These polycystic ovaries, these are all symptoms, but doesn't mean that you have to have all of them. So for instance, a lot of the classic example is you'll have a woman go to the doctor and the doctor will say, well, you're not overweight, you don't have PCOS, which people are told all the time. But you know what? Not everyone with PCOS, I think that's a big myth, is overweight. And so there are 4 types of PCOS. We have inflammatory driven PCOS, and that's where there's a lot of inflammation going on in the body, and that in itself can throw hormones out of balance. It can prevent ovulation. We also have insulin resistance PCOS, which is the most common. About 70%, it's estimated, of PCOS cases are insulin resistance cases. And what happens is when we have too much insulin, it causes our bodies to make too many androgens, which can shut off ovulation. And then we have post-pill PCOS, which is just, your body temporarily goes into a state of anovulation and PCOS post-birth control pill, because our hormones are just all over the place. And then we also have adrenal PCOS, and this is where our stress hormones, namely DHEA, are very, very high. So, and it doesn't, when I think about this, I think that we can have more than one. It doesn't have to be, okay, mine is this, this, and this, but also one can cause you to have the other. If you have insulin resistance, well, chances are you're going to have high inflammatory markers as well, and, and then stress levels because so it's kind of take everything with, it's not black or white really. And I think that's what we really need to understand with polycystic ovarian syndrome. It's not black or white. It can show up in many different ways, and there are many different ways to treat it.
Yeah. And I think that when you mentioned the lean versus overweight PCOS, the two types of pictures we see, I feel like there is a disservice done to women who suffer from the lean type of PCOS, because oftentimes they're not investigated further until they're trying to get pregnant, and they've been maybe 6 months to a year out. And then it's like, oh, we realize you're not ovulating. And so making sure we kind of bust that myth that you don't have to be overweight to have PCOS. And so I find in a lot of my patients, actually, I don't know how the testing is where you are, but I know a lot of medical doctors are extremely resistant to run fasting insulin. And so I end up running a lot of fasting insulin. And what I find with the insulin resistant PCOS, in a lot of my patients, they say, well, my HbA1c is fine and my fasting glucose is fine. It's like, well, it's not the same as fasting insulin. And there has been research to support that fasting insulin is the first thing that happens before all of the other slew of things leading to diabetes.
And that the fasting insulin test should definitely be taken, especially if a doctor is going to put someone on metformin.
Yes.
Because maybe they don't even need metformin. And also well, maybe none of us need metformin. We can just need to focus more on dietary changes. But there's resistance here with that. I think maybe because it's more expensive and it requires more time. It's a very it's a lengthy test, right? Yeah. But yeah, the same resistance here. And I'm sure it's the same resistance here as it is there with thyroid, advocating to get thyroid panels or hormones in general. I mean, at least once a week, I have a client tell me that's, my doctor told me that I didn't need to test my hormones.
Yeah.
It's like, what? Or that there's not such thing as a hormone imbalance in the first place, which is just absolutely.
You can go down a rabbit hole with that went a little bit viral, but I think it's so wild. And the reason I speak to my patients about this all the time, I'm like, unfortunately, the tools they have in their toolbox are number one, birth control, and number two, hormone replacement therapy. And both of those tools, they do not test your hormones for. So in their opinion, they're saying, well, I don't test when I put you on hormones. So why would I test in any other setting? Except when you're getting pregnant, then randomly it starts to matter. But before then, it doesn't matter. Hormonal imbalances don't exist, except when we start to do day 3 and day 21 blood work in a fertility patient. Then I guess they do start to exist, right? So
exactly. It's really contradictory.
Yeah.
Completely.
Very interesting. And so kind of different types of PCOS we've discussed. Now, how does one get a diagnosis with all of these different types? Like, what are the investigations? Because I have patients who will be like, I have cysts on my ovaries, I have PCOS. And I explain to them that's not necessarily true.
Yeah. And I think that's the biggest myth there.
Yeah. And so talk to me about a diagnosis.
Yeah. So, I think it takes, I don't have for endometriosis, I know that it takes the average patient 10 years to get a diagnosis. I don't know how long it is for PCOS, but I would gather that it's something probably not as long as 10 years because endometriosis, you have to have the laparoscopic procedure. But I think that the woman with PCOS has been given misdiagnosis many times before she's actually given it. So I see it both ways. Someone's diagnosed with PCOS, but they don't actually have it. Maybe they have hypothalamic amenorrhea.
Yep.
Or vice versa. So to get, I recommend the full blood work. So, inflammatory markers, definitely LH and FSH, because we know that there's an inverted ratio there. Typically women with PCOS have high LH, luteinizing hormone, test androgens, because there's two criteria for PCOS. Basically, there's a Rotterdam criteria and the androgen excess society criteria. Rotterdam's a bit looser. They say you have to have 2 out of the 3. The first one is irregular cycles resulting in, irregular ovulation. The second one is clinical or are biochemical hyperandrogenism. So elevated androgens on a test, or symptoms, physical symptoms of high androgens like hair growth where it's unwanted, male pattern baldness, polycystic ovaries on an ultrasound. So you would only need to have 2 out of 3 of those according to the Rotterdam criteria. And then with the androgen excess criteria, you need to have all 3 of the following, which is the irregular ovulation, the clinical or physical symptoms of high androgens. And then also the third one is exclusion of any other conditions that would cause high androgens, like a pituitary tumor, pituitary diseases, hyperlactin, things like that.
Thyroid.
Thyroid, hyperthyroidism, definitely. And so what we're finding is that women are going to their doctors and they're getting an ultrasound and they have polycystic ovaries and they're being told that they have PCOS, which there's so many fallacies. First of all, if you're a teenager, that's really common to get polycystic ovaries in the first few years of cycling. And all women will have polycystic ovaries more than once in a cycle. That happens sometimes. Also, not all women with PCOS have polycystic ovaries. So you could be misdiagnosed and not saying, they could say you don't have it if you don't have the polycystic ovaries. So that's why it's really important to do the blood work. Also looking at the androgens, I also find adding in a Dutch hormone panel, the dried urine metabolite test, is also very beneficial because it shows how the testosterone in the body is metabolizing. Because sometimes you'll have a woman that has normal testosterone, but it's metabolizing in a really potent way that makes the androgens very potent. So I think having that information, a Dutch panel, the blood work, also an ultrasound can't hurt. That's the more information, the better. But and finding somebody that has some experience in PCOS would also be beneficial. Always seek a second opinion on anything. I think we all should do our due diligence.
Yeah, and I think that a lot of women, the buck kind of stops at, oh, you have regular periods. You don't need any more. And so I think a myth about PCOS is that we have these anovulatory cycles, which we've spoken about. But if you have a regular period, we're assuming that you're regularly ovulating, which is not necessarily true. And I think there's a lot of misdiagnosis there as well, because the doctor will say, well, you have regular periods, end of story. So they don't really take into account kind of what ovulation looks like. Another myth, PCOS is only a problem if you want to get pregnant.
Yeah, women with PCOS are more likely to have, inflammatory diseases down the line. So heart disease, to name one. So, inflammation in the body is not healthy. It's never healthy. Inflammation really is a root cause of all disease, in my opinion. Like it's so, if you have this inflammatory condition and you have this condition that makes you prone to anxiety or, to inflammation in the body, then doesn't it make sense to get to the root cause of that so you can live a vibrant life before you're ready to have kids? And also, it's the work we do. We should always want to be fertile. I think fertility has it's got this negative connotation. Whenever we say the word fertility, people are like, oh, that doesn't apply to me. I'm not ready to get pregnant right now or ever. It's like, no, like being fertile is a sign of health. So we always want to be fertile because that means everything in the body is working properly. So, and that's why one of the reasons the birth control pill or any type of hormonal contraceptives are doing a huge disservice sometimes. I'm not saying they don't play a role, they play a great role. And I think everyone should have a right to them. And pregnancy prevention is awesome. But it is playing a huge disservice in covering up these issues. So then when women get off the pill and they're ready to start a family, they're like, oh, wow, I can't. And they don't know what's going on. And they're starting from ground zero because they've never addressed this issue, because as far as they were concerned, everything was running smoothly for the past 15 years. They've been on the birth control pill. They get off of it. All these things happen. And then we're seeing this trend where the first thing they do, they're referred from their primary doctor to a endocrinologist, a reproductive endocrinologist if they're lucky. And they're like, oh yeah, IVF, let's do it. Let's go.
Yeah. And I think the other thing is when you're young, and so this cascade of events happens, right? You're young, you're maybe 15, you are diagnosed with PCOS or you're not. you're given the pill and you go on your merry way. And 15 years later, you come off the pill, you may be overweight because the birth control doesn't stop you from being overweight with PCOS because it does worsen insulin resistance, as we know. So you're getting these periods every single month and you think everything's fine, but you're gaining weight and you're kind of like, I don't really know why. And you have acne and you have all these other things that are not being masked properly by the pill at that point. You come off of the pill and now you're like, I want to get pregnant, or you don't, either way. But in the ones who want to get pregnant, they may already be extremely overweight. We know PCOS, like you said, inflammatory conditions, things like diabetes, things like heart disease, metabolic syndromes that are increased. And now we're at a point where your cholesterol is high and you're actually pre-diabetic when we could have looked at it earlier and we didn't intervene. And now you want to get pregnant. Now they're saying IVF. And guess what? There's a BMI cutoff for IVF. There's a healthy BMI cutoff. And so I'm in the fertility clinic all the time. I work also at a fertility clinic. And part of what I see is the referrals to IVF and the automatic of the doctor saying to the patient, well, now you got to lose 50 pounds or else you cannot start IVF. And wouldn't it be awesome if somebody told you to lose weight and you would just lose weight? Oh, thank you for letting me know.
Yeah. It's not like I've been trying or, and that's right. They're not given the information in how to sustainably lose weight. And I also want to reiterate that that is also a huge patriarchal attitude in the medical community. If someone does have PCOS, they just tell their patient to lose weight.
Just lose weight.
And that's not the only thing that's going to make us better. And it's not just, it's healthy and sustainable weight loss, but that's a side effect of making the other changes.
Yes.
But you're totally right. I went to a PCOS awareness meetup like 3 years ago, and it was in Houston, and it was at this IVF clinic, and it was a PCOS awareness kind of, and I was like, I'm just really interested what they're talking about, this IVF clinic. So I went and I joined, and it was, before it started, there was, like a snack bar. And first of all, the snack bar was like donuts and all these things that women with PCOS, as we said, I have PCOS too. So I know this, like if I eat donuts and all this stuff, like my blood sugar is going to go nuts and crazy. It's not to say I don't have balance and I don't eat, desserts and stuff, but it's just to me, it was very counterintuitive to have all of these. There was nothing healthy on it. It was nothing healthy on the table, like sodas and donuts and all this stuff. And, I'm talking to a few girls there, and, and I was like, so, why are you here? And they're like, well, I'm a patient at this IVF clinic. I'm going on my 3rd round. My husband and I have been trying for 5 years. This is a young girl. Okay. She couldn't have been in her, she's probably in her early 30s.
Yeah.
And so that means that this journey has been going on for a while. And I was like, oh, that must be so frustrating. And I was like, so has anyone ever discussed with you the importance of, nutrition and blood sugar balancing, diet? And she goes, what? Blood sugar? And I was like, yeah, has anyone, ever talked about how, with PCOS, we tend to have, prone to insulin resistance, and it's really imperative for us to balance our blood sugar levels. And she was like, no one's ever said anything to me. And she's on her 5th round of IVF, and no one has said anything to her about the role of food with PCOS. And as far as I'm concerned, food is the most important tool we have as women with PCOS.
Yep. Food is foundational.
Most important, foundational. And so it's a huge disservice that how much money is 5 rounds of IVF? Because in the US, insurance doesn't pay for that.
Yeah. Yeah. I was just going to say, how much money has she invested in this IVF journey? Right. Yeah. And even in Canada, so we have it's like an 18-month wait list for 1 round of IVF to be covered by insurance. After that, it's $20,000 a pop plus $5,000.
Huge money-making industry.
Yeah.
Money-making. It blows my mind. And you know what? I'm not saying if anyone listening has had their child from IVF, that's amazing. Yeah. Congratulations. Yeah. And I think IVF is an amazing tool, and it shows how far science has come. Yeah. My only thing, I'm not anti-IVF by any means. I just think that when we are first experiencing fertility problems, so say we're not getting pregnant after 6 months, a year, instead of first diving into IVF, we should give it 3 to 6 months to put in some foundational changes, do some blood work, tweak the diet, take a few supplements, make some lifestyle changes. And if that's not responding, and also the partner as well, because remember, it takes 2 to have a child. It's not just the woman's responsibility. Yeah. And if that doesn't work, then start talking about IVF.
Yeah.
That's all.
Yeah, and I would even go as far to say as do that and then even start talking about IUI. Like even before we get
Yes.
into
Yeah,
all the other stuff. Like
absolutely.
we need to try the foundations, and this is one of the problems I see, a little bit off topic, in the fertility clinic. Most of the patients I see are PCOS, so I guess it's not really off topic, but I see patients and by the time they see me they're like knee deep in their third IUI, already done so many medicated cycles, and I'm like, wow, let's just like pump the brakes for a minute. Let's give
Yeah.
ourselves, and then I'm negotiating saying, can we take a few months off and work on the foundations, and let's get your levels down. Let's get this fasting insulin down, because you can try and try and try, but I want to get you into the best case scenario of trying. It's okay if you need IUI. It's okay if you need IVF,
Yeah.
but let's get you in the best possible scenario, because guess what? If that IUI works, even if you have high fasting insulin and you're obese, guess what? Pregnancy is going to be hard
Mhm.
with all of those additional risk factors on you, right?
Think
We're
about gestational diabetes, you're going to be more at risk. So if you
yeah,
don't get to the root cause of this now, then it's going to be a much more difficult pregnancy. You're right.
yeah.
Yeah.
And so I think that we get laser focused with I just want to get pregnant. Let's get pregnant. But let's think about your health in pregnancy. Let's talk about, even if this does work, where are your risks again? Right? Where are your
Mhm.
risks for labor and delivery? Where are your risks for preterm labor? Like you said, gestational diabetes, hypertension, all of these other things that happen, right? Preeclampsia. And so that gets scary. So just kind of reiterating that the interventions are there for us when we need them. But I think you and I are both agreeing that we just need to take a
Mhm.
step back, look at the picture, reevaluate, and then let's kind of dive in. Um, Now, we talked about the myths. Let's talk about treatment. So let's talk about what are some, now obviously it is individualized, but let's talk about why or why not birth control is not an option. I think you've already touched on this, but
Mhm.
let's just kind of reiterate. And then we'll talk about diet and lifestyle and supplements, and what are some things we can just start doing overall to better our health with PCOS.
Absolutely. Because I think this is a very empowering discussion because there's so much we can do. So we should feel empowered because there is so much we can do. But first of all, going with the allopathic route for treatment, I would be rich if I had $1 for every woman that told me that their doctor put them on birth control to treat PCOS. I mean,
Yeah.
it's so counterintuitive. And, like, as you said, right, insulin resistance is a root cause for many types of PCOS. And there's research to show the pill does increase insulin resistance.
Mm-hmm.
It also causes nutrient deficiencies. So here we have insulin resistance, we're depleting our body's nutrients, so we can't make enough thyroid hormone. Our body's not getting the building blocks that it needs. And then it's the pill disrupts the microbiome, disrupts gut health. So
Yeah.
then we have more, bacteria in there that is releasing these, gram-negative bacteria that's causing even more inflammation. So it's just a whole host of disaster that when women do get off the birth control pill, and they have PCOS, it's going to make it a bit more difficult to start regulating their hormones afterwards. Not to mention that there's a lot of research that shows, a lot of, oral contraceptives and hormonal contraceptives can cause, um, you know, can lead to depression and anxiety, which women with PCOS already struggle with.
Yeah.
So it would definitely not be my first choice,
Mm-hmm.
or, at all. Like if a woman with PCOS says, I need pregnancy prevention, and they're taking it for pregnancy prevention, then that's great. That's what it's designed for. But if you're taking it to treat PCOS, that is look another way. So a second one would be an allopathic treatment would be metformin. And this is a bit more like, okay, this doctor would be more woke. Let's say that if they were doing metformin over the birth control pill, they'd be like, all right, well, I do see that this is a metabolic syndrome
Yes.
and insulin resistance does have a place in it. Hopefully this doctor is on a fasting insulin test as well. And they put them on metformin.
Yeah.
Now, the thing with metformin is it depletes the body of B vitamins. So that's not great. And then you have a lot of GI upset from it. You heard the horror stories of like, I take metformin, but it just makes my stomach so upset. Um, and depleting B vitamins we need B vitamins for methylation, for everything. So, that's not that wouldn't be my favorite choice. And then ovarian drilling happens sometimes where they I don't know exactly how they do it, but they drill little holes in the ovary, right? And because a lot of times the ovaries get hard in women with PCOS, and it helps you ovulate. I don't know the mechanics of that. I'm not a
I don't
surgeon, so
either.
I'm probably not describing it well.
I don't
And I
either.
don't know how often that's done anymore. Fun story, just when I was, I had a emergency laparotomy when I was on my honeymoon in Thailand many years back, and I had an ovarian cyst that ruptured and hemorrhaged, took off a piece of my ovary, and I was hemorrhaging to death. And luckily my husband got me to the hospital in time. They had to operate immediately. And then when I woke up after, like, I had got it, they were like, oh, and by the way, we did ovarian drilling while you were under. And I was like, I never asked you for this consent much.
Yeah.
And it was nuts. Anyway, so, I mean, so far that doesn't seem to be any implications. Everything, my symptoms are still in remission, but,
So far, I think it's fine, but I guess we'll to be determined.
yeah, but I was just like, and it was Thailand, but it was a private hospital. I don't know. But anyway, that was fun. So hopefully that wouldn't happen in the US, but I've also heard stories. So, or in, Western worlds. So,
Yeah.
okay. So those are the allopathic tools we have.
Yeah.
Now, if you want to go and you want to work with, holistic, holistic modalities instead of metformin,
Yeah.
right? You would focus on a low glycemic diet.
Mhm.
So that doesn't mean fad diets or cutting out food groups.
Yeah.
That just means like, hey, whole grains instead of refined grains. And
Yeah.
let's prioritize protein and healthy fats. And, if we're going to have pancakes, and let's put some Greek yogurt on top of it, because protein and fat help slow down the absorption of glucose. It's not about like just living in deprivation by any means, right?
Yep.
So it'd be like eating a low glycemic diet. It would be taking supplements like resveratrol, berberine, what's the other one? Ovicitol, the inositol blend that also helps with blood sugar regulation. So these would all be great supplements that could take the place. I think that there have been studies that show berberine just as effective as metformin. So that would also be something you could do.
I was just going to say, I like berberine too because of its antimicrobial actions. It also helps with acne as well.
Wow. Yeah. I never thought about that actually, that it
Yeah.
would help with acne.
Because
So
some people respond really well to like antibiotics, right? Oral antibiotics for their acne. And so I find berberine plays that little bit of a nice balance between being an antimicrobial, but also helps with blood sugar, which is kind of nice.
that makes so much sense. And like thinking about antimicrobials, cleaning up the gut. So that would be another functional holistic, tool I'd use is getting a comprehensive stool test, cleaning up the gut, because a lot of women with PCOS have, dysbiosis. So they have too much bad bacteria. It's releasing these inflammatory compounds. So looking into gut health, exercising, finding a movement that you enjoy that will help lower stress as well, stress hormones, and gets the body moving. And that also helps with sustainable and healthy weight loss. If you are someone with PCOS who is, your BMI is elevated, acupuncture is also very beneficial.
Yeah.
I mean, and, lifestyle changes. So, calming the nervous system. I think this is for women with PCOS and just anyone with hormone issues. We forget about the breath and this, the nervous system. If it's in this fight or flight mode all the time, our stress hormones are going to be elevated. It's impossible for this healing to happen if you're constantly stuck in this sympathetic fight or flight nervous system. So things like journaling, prayer, gratitude, breath work, yoga, mindful walking, laughter, and sleeping more can help with, calming down the nervous system. And, so I think though that would be key.
Yeah.
Definitely. If you're listening to all of these, it's like, having these kind of like these integrating some time every day to focus on the breath or just mindfulness goes a long way.
I think my a holistic nutritionist I also work with always recommends like mindful eating, like just taking deep breaths while you're eating. And it's just such a simple thing. We need to rest and digest.
And we can't do that. If we're eating while we're working or whatever, our body is not going to be digesting that food.
Or we're starving and we like scarf it all up. Not going to work. So again, and I like that you mentioned with the blood sugar, the diet rather, balancing blood sugar with the breaks. I like to call it the breaks, fat, fiber, protein, right? Slow it all down. But
Yes, that's a
also
great way to put it.
not getting rid of food groups. I think
Mhm.
people know what we're talking about, but it's not good for PCOS to go extremely low carb. It is not healthy. It is not good for hormones. It's not good for your thyroid. Women are not small men. And so the research that we see on the ketogenic diet on men does not apply to women.
No, absolutely not. And especially think about if you have the stress adrenal PCOS and your stress hormones are elevated, intermittent fasting and doing keto is just going to increase the stress hormones. It's not the right diet for you. And, I used to be on the philosophy of like, okay, a keto diet can be therapeutic and it can really help people.
Yeah.
And, I personally think that the keto diet is just too rigid and causes a lot of stress to follow and can be overwhelming. So then it's causing you to have to be stressed out, which is counterintuitive if you're trying to calm the nervous system. So, I do think for some women with PCOS, a very like intermittent fasting can be beneficial, but not like these crazy long intermittent fastings that we see a lot of people do. Like something like definitely 12 hours minimum.
Yep.
And that shouldn't even be called intermittent fasting. That should just be called what we should be doing. Like 12 hours between the last meal of the day and the first meal of the day to give our digestive system some time to, repair and to have a break. But like starting with like 13 and then 14 and, some people feel good if like a few days a week they do 16 hours, but it's up to the individual. Like your body will let you know if that's good for you or not.
Yeah. And I remember distinctly when I was in naturopathic college, obviously my adrenals were not okay. And so I tried doing intermittent fasting and it didn't work. I felt like crap.
Yeah, I bet. Yeah.
I probably didn't have the proper cortisol awakening response to handle my energy for the morning, to handle my blood sugar for the morning. So the fact that I wasn't eating till like 1 was not okay for my system.
No, definitely not.
Dizzy and lightheaded. And so that is why we talk about the individualization and getting a diet that's right for you. So that's
we all learn through experience like that, and you learn through experience, which is great because now you can help your patients. And you see this, I saw, you see women trying to get pregnant who are doing intermittent fasting. I'm like, dude, no, don't, please eat as soon as you can in the morning. And something within a few hours of waking up, I think is key. So also I think if a sustainable way of doing intermittent fasting would be to, eat earlier in the evening. So then when you wake up within an hour or two, you eat.
Yeah.
It's not really to wait, oh, I need to have 14 hours and that's, 12 o'clock. No, like eat earlier or don't do it at all because so there's many different ways about, the fasting, I guess, is so contentious. I mean, there's so many different viewpoints on it. And I think like bottom line, it's just like, it's different for everyone. There's not just one answer. Is it good or is it bad or?
Yeah. And I think like, well, you and I would both be out of a job if there was a magic pill or a magic food that would fix everything, right? Like we know it's the foundations, we know it's individual. Everyone has different things, whether it's genetics, stressors, that sort of thing. It all plays a role. And so making sure that you're getting the support you need is so important with even mastering the foundations. So to wrap it up, I'm super happy that you were here. It was such a fun conversation and I hope to have more going forward because I'm sure a lot of people will benefit from this conversation. So thank you for joining us.
Yes, thank you, Laura. I mean, this was just, I could chat like this all day about this. I'm sure we could go on and on and on. And
I know, me too. I'm excited to possibly talk about different topics in the future because this is the tip of the iceberg. Even with just PCOS, we haven't even gone really, really deep into it. But you have a freebie for anyone listening that they can find and download. We have a Period 101 ebook. So tell our listeners a little bit about that, and I will link where you can get it in the show notes.
Awesome. Yeah, this is an ebook I have for download on my website, and it is an actionable guide that helps you get pain-free regular periods, and a lot of information in there will be helpful for women with PCOS, endometriosis, having any type of period problems, hormone imbalances. You'll find some gems in there for sure.
Amazing. Well, thank you for joining us, Jenna. It's been such a fun time. And this has been the Well Women podcast. Thank you for listening.
Thank you, Laura.
No problem.